Hey guys, sorry it took so long to get this posted. This is from the post I made a few days ago. The 68-year-old patient with 2 weeks post-cabbage, continued chest pain, shortness of breath, poor exercise tolerance. And they scanned him, and of course this is what they found. So this is the left lower posterior lateral wall, and by that it's just a little superior from where you do a normal fast exam from to view the, since we're talking left side, to view the spleen and kidney. So this is a little more superior. And let me play this again. And you can see that it's looking a little unusual. This, once it stops, this right here is a spleen. This structure is the diaphragm. See if I can write without it looking like chicken scratch. This is all free fluid in here, but this is pleural fluid. This structure here is a lung floating in there, so obviously that's not too good on that left side. This here is your spine, which you should not see. These are the vertebral bodies, and this is called a spine sign. And what this means is there's fluid allowing this to be seen, because if it was just tissue, the ultrasound would bounce back and you wouldn't see that spine sign. You'd see the little pieces of the spine here, but where the diaphragm takes off, you wouldn't see this anymore. And this is a right lower posterior lateral wall. Again, this is just superior from where you would do a fast exam if you're looking at Morson's pouch between the liver and the kidney. And let me play this for you. So you can see this looks a little odd as well. Once it stops, this is the liver, and here is diaphragm. And again, these are your vertebral bodies, and you should not be seeing this. And again, this is called the spine sign. And it's indicative of fluid, which is right here. So this pleural effusion is much smaller than the left side, but it is present. So here is an apical 4-chamber view. Let this play out here. It looks pretty interesting. And you want to know if it's a pericardial effusion versus a pleural effusion. And you can see there's a lot of fluid here. All this black anechoic is fluid. And of course, LV, RV, RA, LA up here. This is what looks like probably descending aorta. Let me play that again here. So you can see there's doesn't appear to be anything between the pericardium and the heart. So it doesn't look like there's a pericardial effusion there, only a pleural effusion. This is parasternal long axis view. And none of these views are that great, sadly. The 4-chamber, this one's not that great. But you can identify the structures and kind of see what's going on here if you look. But again, you want to know where this fluid is. Is it pleural or is it pericardial? And you can see right here, this is the descending aorta. The fluid is on this side of it, so it has to be pleural. All this dark anechoic here is fluid, and it's pleural. This is a rib right here, and this is your pericardium coming here. And let me play this again real quick so I can stop it where we can actually see. Maybe, here we go, it's a little bit better. So this is your aortic outflow tract here, and this is left atrium. This is going to be your mitral valve right in this area. And of course up here is RV, and this is LV in there. So you can see you don't really see any fluid around or in between the pericardium and the heart. It's all below this descending aorta. Let me play it one more time here. And this structure here is a vertebral body. Of course, the rib coming off of it. So let me get on to the next slide here. That's it. Okay. So just a short, quick one on the case that I posted a few days ago. Kind of a little too complicated just to mark up and try to type it all out. So I hope this helps. When you do a fast exam or a cardiac exam, make sure you look at the those segments on both the right and left side to determine if it's pleural effusion or pericardial effusion. Some resources I really highly recommend. Life in the Fast Lane, where these images came from. A truly outstanding resource, which I highly recommend, obviously. And just do a search, Life in the Fast Lane, it'll pop up. They have x-rays, they have ultrasound, they have EKGs, they just have all kinds of great learning resources. EM Crit with Scott Weingart, just the best critical care EM podcast out there. I listen to these over and over again and learn new things every time I listen to them. Has cheap CEUs too, by the way. I think $69, you get 25, which is just unheard of. EM Wrap, I really, really like this podcast. Their CEUs are a little more expensive, but one nice thing about them is they're broken down for if you need a breakout in how much pharmacology CEUs you have, etc., like some of us do. This breaks it out and makes it really easy to keep track of them. Ultrasoundpodcast.com, Mike Mallon and Matt Dawson, Mike Stone occasionally, Jacob Avila. Just outstanding. I've learned so much from these guys. I've gone to a conference where they've been at teaching. Just nice guys, and put out just a great product. 5 Minute Sono, Jacob Avila, he's hilarious, nice guy. And again, these are ultrasound gurus for the emergency room, and I highly recommend you go to these sites and check them out. And last thing, Twin Oaks puts on point of care, critical care ultrasound classes that are just unmatched, truly outstanding. Jonathan Klein, Brian Sele, true masters of the ultrasound and its uses. I learn something every time I talk to them, and they're the ones I go to when I have questions. Go to their site. I have it posted there. They have a lot more than just the one Tampa one there. They also do cadaver labs, peripheral nerve blocks, just all kinds of stuff. So go check them out, and hope you guys have a great day. Thanks.